Assalamu alaikum. Welcome back from the ad break. You are still watching Prime Live. Tonight we are talking oral health care with Dr. Faheema Ismail, an expert in dentistry and oral hygiene. Dr. Ismail will offer valuable insights into the crucial importance of maintaining good oral health and preventing common dental problems. Now, this is going to be a very interesting conversation that you want to stay tuned in for. Assalamu alaikum, Dr. Faheema, and welcome to Prime Live.
Walaikum salam. Thank you for having me on your show.
Jazakallah so much. It's definitely a pleasure. Now, what are the most common oral health problems that you encounter and how can they be prevented?
Okay, so the most common is dental decay, which is caries, and people come into our rooms daily. Cavities as well as poor oral hygiene. And also, another factor is staining of teeth due to tobacco use and also frequent consumption of tea, coffee. But the most important is the cavities that we encounter daily.
hmm And how can these be prevented? Would they now mean that one has to stop drinking coffee, smoking, in order for them to prevent their teeth from staining?
Okay, so basically everything has to be done in moderation,
hmm
and anything in excess is detrimental to your health, especially to your oral health. And especially smoking, it reduces the blood flow to your gums and tissues, it decreases your bone levels, it also destroys the support structure of your gums and your teeth. And also, coffee and tea in excess will definitely also damage your teeth.
hmm
So our diet also is really important because with regards to the cavities, if there's a high amount of sugars in your diet, that contributes to dental decay. So we need to control all those factors in order to have good oral hygiene as well as to prevent dental issues.
Hmm. And besides the factors that you have mentioned, are there any surprising factors that can actually impact your dental health?
Okay, so nowadays, stress is a major factor that contributes to the detriment of your oral health. So, patients that are very stressed, they present to our rooms with teeth that are worn out, and they also get TMJ problems, which is pain in their jaws. So, stress is a major factor, and we're seeing it more commonly in our practices daily. So, patients need to make sure they come in every 6 months for a good checkup so that we can assess whether we need to prevent these further from destroying your teeth.
Mm.
And also, it takes a toll on your gum health. Besides stress, also things such as, for example, chewing on ice. Patients present with cracked teeth, and little do they realize what harm it actually causes to your teeth. Also, patients that are on chronic medications for diabetes, high blood pressure, also asthmatics, they present to our rooms with dry mouth, also inflammation of the gums, and decreased saliva flow, which also contributes to caries in their mouth. So there are a few factors which we might not be aware of, but these are some of them. And also another one is that many people think that the harder you brush, the better it is for your oral health, whereas in fact you're actually causing more damage and trauma to the gums and the teeth. So if you're brushing too hard, you need to start changing your brushing technique. You need to go to your dentist, let them advise you on which toothbrush to use, how to brush your teeth, and also what you might be doing incorrectly to prevent further damage to the gums and the teeth.
Hmm. Now, how do you incorporate good oral hygiene into a busy lifestyle?
So I think your mouth is the most important part of your body, and we don't realize it. Also, as Muslims, cleanliness is half of our iman. So if we can't be clean, and if we can't keep our mouth clean, then basically we are not. performing what we should. And like I said, it's half of our iman. So there's no excuse not to maintain our oral health. Whether our life is busy, it has to be part of our routine. So
Mm-hmm.
daily, like how we have a shower and when we make wudu, we have to also make sure that we take care of our oral health. And most importantly, the brushing twice a day, which is in the morning and at night. We need to use a mouthwash daily. Even if you can't use a mouthwash, warm water and salt, which is also good for you. And we should also use the miswak daily. So it's a sunnah of Nabi sallallahu alayhi wasallam. Let us inculcate a sunnah, revive the sunnah. It's good for our health, for our eyesight, for our mind, and most importantly, for our teeth.
Mm. Thank you so much for sharing that with us. Now we're living in an era where everybody is having cosmetic dentist. What do you call this? Teeth whitening. Everybody's putting on new teeth. Everybody's, getting obviously what I would say a facial or a facial for getting an uplift for your teeth. That's what other people call it. What are your thoughts on teeth whitening? Are they safe? And when do you, as a doctor, recommend it? Is it something that I can just wake up and decide this is something that I want to do because I've always had bad teeth? Or are they, is there a process and recommendations for going through such surgeries or whitenings?
Okay, so you are right in saying that people are becoming more aware of the aesthetics and cosmetic dentistry has become a big thing. But first and foremost, we need to get back to basics and make sure that we first go every 6 months for a routine clean and polish. The clean and polish obviously doesn't whiten your teeth, it removes plaque and surface stains. If you want to enhance the whiteness, then we would recommend teeth whitening. And not everybody is suitable to do teeth whitening. So you need to consult with your dentist first whether your teeth are favorable to do the whitening. If you generally have extremely sensitive teeth, we wouldn't recommend it. If you have cavities, if you have toothbrush abrasion, or if there is any form of attrition on your teeth, we wouldn't recommend the teeth whitening. So it's a good idea to first consult with your dentist. For people that have teeth that are in the optimal condition, it is a nice thing to do. It really does enhance the whiteness and it gives you that beautiful white smile. But it is better to do a professional teeth whitening at the dental surgery, and the results are amazing.
Mm. Thank you so much for giving us advice on that. Lastly, before I let you go, for those who fear the dentist chair, how can you help them feel more comfortable during checkups?
So the first thing is you should make it a routine to visit your dentist. Like I said, every 6 months is a must. If you need to come more often, you're welcome to. Also, make it a family visit. So if you can come with the kids, come as a whole family. And that is why I actually launched the We Care for Oral Health campaign where I get invited to schools around the country and I educate kids and our youth and I try to break the fear of going to the dentist. So the dentist visit needs to be an enjoyable, a wonderful visit, something that you look forward to. And if you come routinely, it's always going to be a pleasant experience. So there's nothing to be afraid of. And your dentist also will be caring, loving. Also, she's there to explain to you every step along the way. So, like I said, there's no need to be afraid. And obviously, if you leave things for the last minute and if you're in pain, you're going to have a miserable experience. So, don't wait until you reach that stage. Try to visit the dentist as often as possible, and you're going to love the dental visits.
Mm. Dr. Faima, thank you so much for joining us and just for giving us insight and educating us on how to have, a healthy mouth and how to, look after ourselves and look after our mouth because it's also one of the most important parts that should be prioritized in terms of health. So thank you so much for joining us.
Pleasure. Thank you.
Jazakallah so much. Viewers at home, I hope you understand and you have taken up some lessons on how to better take care of your mouth and make sure that orally you are healthy. But without wasting any time, we will go to a quick ad break. When we come back, we still have more, so stay tuned.